Okay, we're going to introduce the basic rolling pattern. This is a primal pattern. It's the first thing you did as a baby to begin to move. So this is activation of the core and then the beginning of integrating the core into the hip. All right? So we're going to lay flat on the floor. The slower you do this, the better. I'm going to raise my arms up and I'm going to relax. I'm going to imagine that I'm paralyzed from the waist down. All of this motion should really come from activation of the core and the upper body, okay? So I begin by turning my head to the side I wish to roll over to, and then I begin to crunch and connect the opposite shoulder to the opposite hip, okay? So I'm getting that cross connection through the center of my body. And the arms aren't momentum, it's me just placing them over as I make a motion to almost smell my armpit and do some form of a rolling sit-up. And I roll slowly over, not using my legs, they stay relaxed. My upper body rolls over and it pulls my pelvis over until I roll. And then I'll just come back. Okay, so one more time. I'm going to initiate with the head. The head begins all motion. I flex the head. I rotate to the side I wish to roll to, in this case the right side. I act like I'm going to do a partial rolling sit-up and smell my armpit, and my arms follow. Okay, I'm not throwing my arms. The slower you do it, the better your core will be. And I roll over, not using the legs, but letting the motion from my core and torso pull my pelvis into the roll. Okay, I'm going to demonstrate this from the side angle for you. Once again, paralyzed from the waist down. If you have shoulder problems, and this is painful or uncomfortable, I can put my arms into this mummy position, crossing them on my chest. I'll flex, turn my head, smell my armpit, curl, flexing my core from my left shoulder to my right hip. My heels stay on the floor until my pelvis rolls over and brings the leg over. From the other side, flex, turn the head, smell the armpit, sit up, legs stay relaxed, roll over. Okay, this is the front roll. Same action has to be accomplished rolling from the front to the back. Once again with the arms up. Legs are paralyzed. I'm not activating my glutes or my legs. I want to be aware of all the tension. I begin to extend the head, turn over the side I wish to turn to. My arms stay up. And I roll back, being careful not to press my legs into the floor. This is for your core, not your legs. Other side, I extend my back up, look to my left, extend my arm over, and roll. Okay, you're going to find that some sides are more difficult than others. If you're asymmetrical, that should be a red flag. And of course, the side that you're weaker on, you're going to attempt to do more of those than the side you're good on. But you should do 10 to one single side, and then 10 to the other side. I prefer that people perfect the front roll, rolling from their back to their face. And after they've kind of gained some confidence in that, we will take and gain confidence in rolling from the face down to face up position. Once these are easy, or one of them's easy, you can do 2 or 3 of them and then move on to the ones that are really much more deficient than the others. Now let me give you some assistance. So a lot of people won't be able to do this. A lot of athletes can't do this correctly without cheating. It's very important that you mind that you're not using your legs or kicking and flags. So some of the common cheats that people do is that when they start to roll, they'll start kicking their legs up and throwing it over. Okay, that's not what we want. We want to remain paralyzed from the waist down. We don't want to see a lot of the leg flexion. So if I watch someone do this in the exam, I'm simply watching for their feet to move, and that's telling me that they don't know how to activate their core correctly. Okay? If you have a difficult time doing this, there's really two ways that we advise our patients to help themselves, with the goal being not to need help. First part is if I'm rolling and I find that I'm lifting the leg up or flexing in the hips, what I'm going to do is I'm going to make a conscious effort to push my heels into the floor and let my legs press into the floor. I'll flex forward, begin the roll, but then I'll place my left heel into the floor and almost press off of it to help myself roll over. Okay, so from the other side, I'll move back a little bit so you can see this. I'll roll to my left side. If I'm having a hard time and I'm stuck, or I happen to be flexing my legs and can't disconnect that, I'm going to make an effort to push this heel into the floor and push myself over by pressing that heel down. Just a little, as little as I need until I can do this motion. Okay? Once you understand that, you can do that same assist by rolling from your face down to face up position. Another way to do that is to prop yourself up. Perhaps you take some pillows and you place them under your hip or your pelvis so that you're already kind of turned over. And then you'll find it much easier to just finish that roll. After you do a few of those and you gain confidence, I'll thin out. I'll take a smaller pillow. Perform the same action. So once again, I'm not throwing my arms over. I'm coming from the center of my body, connecting my opposite shoulder to the opposite hip, and I'm rolling over. And then when you don't need assistance, you do the exercises we first demonstrated.